4 out of 5 of us will likely need some sort of social care before we die. But while everyone agrees that the system is broken, no one seems able to fix it. We all know the NHS is free when you need to use it and funded through taxes. So if you get cancer or need a big operation, you'll get it without paying anything. But social care is different. If you need ongoing help with daily activities or personal care, perhaps because of old age or a disease like dementia or another disability, then in many cases, in England anyway, you'll have to pay for it. While the price of care varies, average costs for residential care are around £4,600 per month. That's around £60,000 a year. Nursing home care for those with higher needs is even more expensive, averaging around £5,600 per month or £73,000 a year. Now, the average life expectancy for a care home resident who's in their 90s is around 3 years. But if you need care and you're in your late 60s, the average moves up to around 7 years. So that can leave some people with huge care bills to pay.
Let me turn the other way.
During the 2024 election campaign, I spoke to Norman, who cares for his wife Roz. She has multiple sclerosis and dementia, and Norman was forced to sell the family home to pay for care.
My kids learned a long time ago that their inheritance has gone, right? Because we don't have any money left. Yeah, we didn't have any money left a while back.
And Norman isn't alone. The government estimates that 1 in 7 people aged over 65 will face lifetime care costs of more than £100,000. Now, for those with less money, some support is available for care costs. But the amount spent by English councils on social care is now more than £2 billion more than it was in 2010. With people getting older and with people having more complex health needs and budget squeezes, especially after the austerity years, there have been warnings that some councils could turn into little more than care services if more cash isn't put in. For the NHS, it's estimated around 14,000 beds are taken up by people who no longer need to be there, in part because of a lack of adequate care settings for them to be discharged into. Then there's the countless numbers of appointments taken up in hospitals and GPs by people who could have potentially been looked after in a social care setting. A plan to cap costs was first suggested in a review by the economist Andrew Dilnot in 2011. The coalition government put that into law for England in 2014, but then a year later the plan was delayed by David Cameron. Theresa May's attempts at reform during the 2017 election descended into chaos.
Nothing has changed. Nothing has changed. We are offering a long-term solution for the sustainability of social care for the future. Nothing has changed.
2 years on, Boris Johnson also pledged change.
We will fix the crisis in social care once and for all with a clear plan we have prepared to give every older person the dignity and security they deserve.
In 2021, he unveiled plans for costs again to be capped and paid for partly by a rise in national insurance. But that tax rise was scrapped a year later by Liz Truss, then Rishi Sunak delayed implementation of the cap before Labour ditched it completely after taking office.
Most of us are a bit worried about talking about social care. We don't like thinking about becoming frail. We don't like thinking about dementia. We don't like thinking or talking about incontinence. And so although these things are coming towards us, there's a temptation to look away.
Part of the problem is the state of the care sector, with more beds and more staff needed. Figures show a vacancy rate in the sector of almost 10%, far higher than the national rate. Many care homes turn to overseas workers to fill gaps, saying that low wages and long hours mean they struggle to attract UK staff. But there's also been lots of political roadblocks as various governments over the years try and figure out ways to raise cash for the sector. Well, experts say the first thing that's needed is more money for more staff and more beds. In 2020, a Commons committee estimated an extra £7 billion would be needed. The Health Foundation think tank puts the figure at £8 billion by 2032, just to keep up with demand. Then better integration's really needed between hospitals, GPs and other NHS services and the social care sector. This would potentially allow more people to be treated at home, freeing up appointments in the health service. And finally, there really needs to be some sort of political consensus on how to tackle this issue and how to bring something in that can limit the catastrophic costs that some people face that can wipe out their wealth and savings as they move into older age. In Westminster, the Dill Not Cap plan has so far been the basis for that reform, but it's not without its critics, with some accusing it of forcing taxpayers to stump up to allow wealthy people to pass on more money to their kids rather than spending it on their care. This is really an area that's been put in the too difficult box for generations. All eyes are now on Labour in the years ahead to see if they can succeed where many others have failed.